and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
In my
Bob.
opinion, too. Well, that's our opinion, I guess.
Yes.
Okay, today, Brad, we're going to talk about carpal tunnel, how to avoid surgery with a 3-step program. Self-treatment, something you can do yourself. Doesn't work out all the time. I've had patients that have definitely, it's worked for them and they avoided the surgery, and that was cool. So let's start off with what carpal tunnel is.
Sure.
It's carpal tunnel syndrome. People say a lot of times, I have the carpal tunnel.
Right.
Well, the tunnel is a tunnel right in your wrist here where the nerve goes through.
Around the carpal bones.
Or around the carpal bones. Which
Everyone
is the bones
has carpal tunnel, 2 of them.
But what we have here is the median nerve is the culprit here. And that nerve starts up here in the neck, C5 to T1.
This way so they can see it.
Yeah, I don't know if you can see any of this, Lonnie. I can come to you, Lonnie. Let's come to you.
We got wheels. They don't roll, but we
We're
got
not
wheels.
rolling, Are we close enough? All right. It's not Gumby. Gumby's not causing the problem here. We can take this out of his mouth, too.
Open up.
Stop that. Okay. So you're going to have a couple nerves coming out of the neck here, and they go down up over the first rib here, because we're going to be doing a treatment here to show you that. Comes down to the front of the arm, front of the forearm, down into the wrist.
Right. So on Bob, it's going to come in here, and if I could get my finger right under there, there we go, and it comes under here through the armpit, if you will, and they kind of go to the inside of the arm, and they start branching off, and the median one will come right down through the carpal tunnel.
Why is this so important to know, Brad? Because quite often with carpal tunnel, you get what is called the double crush syndrome. And that is the nerve as it's coming out is actually getting some stress on it up here. And then it comes down here and it's already sensitive, so that when it gets a little extra pressure down here, it starts reacting and give you the pain and numbness and tingling into your hand.
Right, so we don't only want to treat the wrist or the hand, but we want to look at the involved
up here.
Right.
And that's quite often what we'll find. We treat up here and sometimes this goes away.
Right.
So we want to do both.
And they're not hard treatment.
No, they're not hard at all to do. So let's start off with, with carpal tunnel syndrome, what you're going to see, the telltale sign is you're going to get numbness and tingling into the generally thumb. What's that? The ring? No, ring finger, pointer finger, middle finger. Half of this finger here usually, the ring finger.
Typically not the pinky.
So this one, half of this one.
Right.
And that's the telltale sign. You're going to get, like I said, numbness, tingling. If you had it for a long time, this muscle here actually might start to waste away.
Right. And you can see it.
Yeah, you'll look at the two, compare the two, and one side will be worse than the other.
Sure.
So what the first thing you're going to try to do, we want to make sure that the nerves have plenty of room to come through and provide this sensation to your hand. So you're going to want to do a chest stretch.
Okay.
So you can do a chest stretch. But a lot of times you just put your hands up like this and you're going to bring your elbows back. And that's going to stretch your chest and leave room for the nerves to come out.
Yeah, we don't want to get them pinched because of tight chest muscles.
Right. The next one you want to do is go ahead and, because a lot of times people are kind of collapsed like this, and it squeezes all this up and puts pressure on the nerves, you're going to go ahead and stretch back like this. Brad, you want to show from the side view?
Sure, you bet. And not only that, I did want to mention with this stretch, you're going to hold it for 20 to 30 seconds, or you can do pressure on, pressure off for 10 or 15 repetitions.
Right.
Okay. This one, Bob said, make sure you get your posture good first and try and get those shoulders open, okay? And then we're going to do that stretch and lean back. And actually with this, you can kind of combine the two as well, Bob, don't you think?
Yeah, exactly. Absolutely. So you're going to start off with that stretch, and then we're going to go into nerve glides. And these are very popular, and they often work well. But I really want to caution you that you want to be very gentle with these.
Sure.
I think a lot of people start these and they go, oh, I'm going to do a nerve glide. And they start really stretching it and they fire things up and then they're all mad at me and they're going to make comments and you have to answer them. And so this is a very gentle thing. You're not trying to increase the pain. You're trying to just maybe bump up and feel the pain slightly when you're doing it. But to do a nerve glide on the median nerve, what you're going to do, let's say this is the involved side, Brad.
Sure.
You're going to go ahead and start off by just putting the hand out like this. You got my whole arm, Lonnie. And you're going to start bringing the wrist down like this, just very gently. For some people, when they start off with this, they can barely just go this far and it starts to feel the symptoms already.
So just extending the wrist right here.
Yeah. Now, after a while, you might be able to go a lot further, and that's great. And eventually, you might even be able to put this up against the wall. Can you be my wall, Brad? This will be the wall.
Okay.
Okay? So now I can always go ahead and stretch it against the wall, and really, that's when you start to make headway here.
Sure.
And then the final part of that stretch is you can actually even stretch your neck this way a little bit. Now you're really getting the full stretch, full flossing of the nerve.
Right. So again, you're stretching a nerve here, not muscle or tendon, so it's very gentle.
Right. Nerve is very sensitive. An alternative to that, one that you might try instead, this is a McKenzie technique. You'll hear us say McKenzie quite often because we're big fans of his, really kind of a pioneer in our field.
Sure.
So this is the same thing on this one, very similar. You're going to just start gently bringing the hand, the arm forward like this. So I'm stretching the wrist this way, and eventually you can actually kind of go stretch like that.
So the elbow is straight?
Yep, the elbow is straight, pressure on, pressure off. So you're going to doing pressure on, pressure off, pressure on,
And let's do it from a
pressure
profile
off.
once.
Okay, I'll do it from the side.
Yep,
So I'm going to start here just very gently.
we'll get
I'm
that.
going like this. And then eventually we're going to go ahead and put a little pressure on it.
Again, this is not an aggressive
Yeah.
stretch. You're not going to be pushing everything and trying to stretch it like crazy.
Do not blame us if you fire things up because we told you not to. That's right. All right. Brad, we talked about how that nerve comes down and it goes over the first rib. Sometimes people even have what we call a cervical rib, where they have an extra rib.
Sure.
And that can put a stress on that median nerve. So sometimes with that elevated rib, what we want to do is a stretch for it. The first thing, before you even do the stretch though, I want to make sure that you're not a chest breather.
Okay.
Some people, they want to learn how to do diaphragmatic breathing. That's kind of a different video, but with the diaphragmatic breathing, when you breathe in, your stomach expands,
Right.
the abdomen expands. So I breathe in, this comes out, now I breathe out, and it goes back in again. Chest breathers do this. And if they're constantly chest breathing, that moves that rib cage up and down. It can be irritating that nerve.
Right.
It's
That's
a
a-
minor thing, but it still can make a big difference.
That one takes practice.
That takes practice.
because
yeah.
we're going to keep the stomach in and tight. We don't
as
have
a
that
society.
stuff. Right.
So show the first rib stretch, Brad.
Okay, so the first rib is a small little rib actually. It's right in here. You saw it on the skeleton if we were looking.
Yeah.
You can take a belt or you can take a sheet. Doesn't matter. You're going to put it, and this works better on a table, not so much on a bed. And you're going to sit right on it, right there, so it's locked in. It has to be long enough to come over the shoulder and right where the neck meets the shoulder. So those big, strong guys where they don't have a neck or a shoulder or whatever, it's a little harder for those
Are you
guys.
talking about me, Brad?
Yeah. And then you let that shoulder drop down.
Start with your head up, though.
Yep, there you go. Thanks, Bob. And then pull down so you lock in
You're
that
pulling
first
that rib
rib.
down.
Yep, and then,
Gently pull to the side.
and it is amazing what this support really does in this. I can feel that stretch now. It feels good, Bob.
With some people, what I do, Brad, is I actually have them do this first and not even do the bend first. I just have them take some deep breaths.
Sure.
And then I go ahead and have them go ahead and stretch over to
Yep.
the side.
Get good.
This one feels good. I actually sometimes, Brad, just take my hand
Yep.
and I'll push down like this and I'll go to the side. Oh, that feels good.
Right.
That's just a great stretch to do. I really like it. Did we get a 5 from you, Lonnie? Oh yeah, long time ago probably, huh? All right, now we're going to talk about positioning, because if you do all these things and you're working at your computer and you're still typing like this with your hands up like this, no matter what we do here, you're not going to take away the symptoms.
Right.
So you want to make sure you're positioned correctly at the computer. The screen should be up high so that you don't go like this.
Right.
You want to have it high enough up. The other thing is that we like, I actually, what you want to do is you want to have your arms vertical here.
Sure.
They should not be forward at all. So I use a lap tray like this, Brad, believe it or not. And
Yeah.
I put my keyboard down here and I go like this. Now, if you have a drawer or something where you can put your keyboard
Right.
like this, you won't need this. But this is exactly how my arm is when I'm typing.
And that's what you want. You want to have it as low as possible and not up here.
But we also want to mention, by the way, a company sent us a couple of these pads. This is eBoot, E-B-O-O-T. I'll put it down below, and I'll put a link to it below. Really nice pad, Brad. If you feel that.
It's gel.
So we were talking about the eBoot, Brad. Again, you called it like a memory foam.
Right. And I couldn't remember it.
Yeah, that's right.
I couldn't
He
remember
loves
the
that
name.
joke. So, and again, this works out really well. So you're going to keep your arms at your side. This is going to go ahead and support the wrist, and it keeps your wrist in neutral, wrist and hand in neutral. You don't want to be like this. You don't want to be like this. So this, if the keyboard's right in front of it, it's going to put it in a good position.
And it feels comfortable, too.
Yeah, it's very comfortable. I'll put the link down below, and it works out really good. Now, this is one that you put in front of your mouse and gives you support. I wasn't a big fan of this one. I just didn't like it. I don't know. But for some people, I think it would work out really well.
I think so.
I mean, some of these are a matter of preference of how you use your mouse and stuff like that. I can see how it puts your wrist in neutral.
Yeah. I had one patient once when she typed, she had a habit. She didn't even know it. She would tap her wrist on the corner.
Oh, no kidding.
Yeah. And it was all this repetition of really light taps caused a problem. We put this on there, and it really took care of it, and she didn't even realize it. Just a little side note.
Yeah, and by the way, as we're in this section of positioning, people that if you do a lot of knitting or crocheting and stuff like that, where your hand is like this all the time,
right.
That's a lot of that stuff is what causes the carpal tunnel. So you're going to have to hold off on that stuff for a while. The last thing I want to talk about is, Brad, is sleeping at night. Sometimes they recommend wearing a splint at night because it'll hold the wrist into neutral. And the studies have shown this does have some benefit.
I'm a big fan of this. I don't care what the studies show because I've had success with this with patients, and my wife uses it a lot.
Oh, does she really?
Yeah, and there's a wrist surgeon in La Crosse that this is one of the first. He won't even send his people to PT. He's taking business away, but he'll have them wear this first, and he says he has great success, and they don't even have to have surgery or PT.
Yeah. So, because a lot of people tend to sleep with their wrists curled or put it underneath them.
Yep.
You want to avoid sleeping on that side. If you're having carpal tunnel syndrome symptoms on the right side, don't sleep on that side.
Exactly.
Crunch it all up. Avoid sleeping with your wrist curled up. And if you sleep on your back, even, Brad, like this, what's nice to do is a lot of times is just go ahead and put a pillow underneath that arm and support it like this.
Sure, you bet.
And then you got that wrist splint on there. You keep it
Supposed to look at the camera.
So, hi. All right. Brad, I think that's a fairly comprehensive video.
Yeah, I think that is.
And remember, we can fix just about anything, but
The broken heart, Bob.
we can fix wrists even, but we can't fix broken hearts.
We could make a splint for it possibly. Wrap it around
Good
there,
idea.
tighten it up.
You're a genius. Thanks.